A sudden pain in your side can make you scream, and the cause may be a tiny stone. Out of nowhere, without any warning, a sharp pain hits your lower back. It spreads to your abdomen and thigh, reaching an unbearable level, and you can't find any position that relieves it. This isn't a normal condition. This is what's known as renal colic, one of the most intense pains a person can experience. What's more dangerous than the pain itself is that this condition can happen at any moment, at home, at work, or while traveling. And what many people don't realize is that what you do in the first few minutes determines whether you get through it safely or end up with complications that may require surgical intervention. The direct truth: kidney stones aren't rare or simple. They're a widespread problem that affects all groups. Anyone who neglects drinking enough water or their diet puts themselves directly at risk. Inside the kidney, crystals form from salts and minerals naturally present in the urine. When their concentration rises, they begin to settle, turning from tiny particles into sand, then gradually clumping together to form a solid stone. Here's the point that changes everything you think you know. Water in your body doesn't just hydrate. It acts as a solvent that prevents these salts from reaching the stage of crystallization. When water intake drops, urine becomes concentrated, and stones begin forming directly. This isn't theory. This is the #1 cause of kidney stones. Diet is just as important. Excess consumption of spinach, chocolate, strong tea, nuts, and salt disrupts the chemical balance of urine. Sodium increases calcium levels in urine, which accelerates stone formation. And if you have a family history, your risk rises significantly. But here's something many people don't know. Not all stones cause pain. Large stones may stay in the kidney for years without symptoms, but they gradually weaken it and create an environment for chronic inflammation. Small particles often pass unnoticed, but medium-sized stones, 3 to 10 millimeters, are the real cause of renal colic because they move and get stuck in the ureter, which is a very narrow tube. And here's when the most dangerous moment begins. The stone starts moving due to sudden effort, drinking a large amount of fluids at once, or even vibration during travel. It enters the narrow ureter, causing partial or complete blockage, and the severe pain begins. The pain is sharp and spasmodic. It starts in the lower back, then moves to the abdomen, thigh, and even the genital area. The patient can't sit, lie down, or find any comfortable position. Clear signs appear: blood in the urine due to ureter irritation, nausea and vomiting from the intensity of the pain, urinary disturbances. If the temperature rises to 38 degrees Celsius or higher, it indicates inflammation. If it reaches 39 to 40 degrees Celsius with chills and sweating, it signals a serious infection that requires immediate medical attention. Now the most important question: what should you do in that moment? This is an emergency that requires calling for medical help immediately. At the same time, there are steps that can make a real difference. Don't lie flat. Instead, sit slightly leaning forward or move slowly until you find the least painful position. Lying down increases spasms. Heat is one of the most effective tools. A hot bath, 39 to 40 degrees Celsius for 15 to 20 minutes, or a heating pad can relax the ureter muscles, reduce spasms, and help the stone move. But heat must be avoided completely if you have a fever or heart problems. The decisive factor here is medication. Not just any medication, but antispasmodics such as Nospa or papaverine. These don't just mask the pain, they treat the cause, which is muscle spasm, and help the stone pass. Strong painkillers may hide symptoms and delay proper diagnosis. Drinking warm fluids can help push the stone, but only if there is no complete blockage. Otherwise, increasing fluid intake raises pressure in the kidney and worsens the pain immediately. Now here's the truth that makes the real difference: prevention. Drinking 1.5 to 2 liters of water daily isn't optional, it's essential. Reducing salt, limiting red meat, avoiding soft drinks, and relying on fruits and vegetables rich in potassium and magnesium all directly reduce stone formation. As for common remedies like baking soda or herbal mixtures, they aren't safe solutions. They can disrupt the body and lead to other types of stones. Using them without medical supervision is a real risk. The key takeaway you must remember: kidney stones are a chronic and recurring condition. Passing one stone doesn't mean the problem is over. It means your body has a tendency to form them. The real solution is consistent prevention and regular follow-up. Now ask yourself honestly, do you drink enough water every day? Or are you getting closer to this experience without realizing it? And don't forget to like the video, subscribe, and share it so others can benefit.